Hi, I'm Matt Koontz, the Executive Director of NAMI Montana. Giving some updates on some of the things that happened at the Montana Legislature, some of the wins in mental health, some of the not so wins that happened over the course of the Montana legislative session in 2023. And it is May, so we're just getting started with this. And this one in particular is House Bill 872 by Representative Bob Keenan. And this is a massive investment in behavioral health care in Montana. $300 million investment. So really significant, really powerful. From our perspective, which might be a little bit different than other people's, it did develop during the interim. And the interim committee dug into all of the mental health challenges after a bill requested them by Senator Walt Sales. So they dug into all these mental health challenges around the state. And then at the same time, there was a real crisis at Montana State Hospital. Montana State Hospital just struggled, and people died, and the workforce issues, all of these things, and it was just so clear that something desperately needed to be done. And Governor Gianforte's office, the Department of Public Health and Human Services, ended up reassigning the administrator and making a really significant investment in a consulting company to come in and run the hospital, work with the state of Montana employees, and carve out plans for other institutions. So all of that was happening. And then the governor's budget came out, and it had a really significant investment for mental health of $300 million, or roughly that. And so that was, for us, it all interconnected. And then when you get to the legislature, House Bill 872 was the bill by Representative Bob Keenan, Senator Esp, and some others to operationalize that investment, to figure out where the ideas were going to come from, to figure out who was going to have authority over it, and to lay out a course for, okay, these are who's going to meet, this is when the meetings are going to happen, and this is how the governor's office and the Montana legislature is going to allocate those funding. So it's going to be a lot of work over the course of the next couple of years, and we really suggest that everybody learn more about it, find out how to get involved, how to engage, and say where they think this funding should be spent. What are some of the cracks in the treatment system? What are different ways that we can approach this care? So we really hope that everybody gets involved with it. We are very grateful to Governor Gianforte, Director Bertrand, Representative Keenan, Senator Esp, everybody that worked together to push HB 872 through, and we're excited to see where it goes from here. Thank you.